usually what happens, you go to the doctor, you know, what many doctors will measure biochemically are some of the risk factors. The big ones, cholesterol, and then many doctors are monitoring your blood pressure, and as well monitoring your triglycerides, fat in your blood. So these are kind of some of the big markers, at least biochemically speaking, in the blood. Now, you've probably, if you've been to a cardiologist or you've been to a GP who does them, or an internal medicine doc, you probably had an EKG where they hook up electrical equipment to your heart and monitor how it's beating and measure that. And so that's a very common thing to do as well. And some people have Dopplers where they have what's called the carotid Doppler, where they run a Doppler through the carotid artery and measure how thick the artery is to try to guesstimate how much plaque is actually there. So these are all just different tools that doctors use. So really, these are the ones that biochemically get measured. Now, if any of these come back abnormal, the first line of therapy is supposed to be diet change. Triangle means change. That's delta. It's just a term. Anyway, diet change. And that's what's supposed to happen. So this is the primary. So then the secondary, if diet change fails, what's supposed to happen is drug intervention to mitigate these risk factors. Because these, in and of themselves, these are not forms of heart disease. I know that's the first myth, is that high cholesterol is really oftentimes used synonymously as something that represents heart disease. High cholesterol is not heart disease. High blood pressure is not heart disease. High triglycerides is not heart disease. None of these are heart disease. They're risk factors associated with developing a cardiovascular event like a heart attack, right? So they're not actually heart disease, they're risk factors. So again, doctors are trying to practice, in this case, prevention. If we can control these three major factors, we can reduce your risk of developing heart disease in the future. But these are not actually heart disease themselves, and that's probably the biggest myth of all, because we live in this world where I'm going to use a made-up word here, where doctors have diseasified a lot of different things. In other words, we created diseases out of things that aren't actually diseases, and these three elements are examples of that. So again, cholesterol, blood pressure, and high triglycerides are not diseases. These are states in the body. They're physiological states. Now, the bigger thing that we need to ask is, if cholesterol is high, why? Right? And how do we define what high cholesterol is? Now, if you haven't watched, I've got a great video on cholesterol myths. I'm going to encourage you to go back into the archives of the Pick Dr. Osborne's Brain Show and watch that episode, because we don't have time to dive into the depths of this today, and I don't want to spend a whole lot of time on that, because I want to talk a little bit more about these other two. Now, blood pressure in and of itself, elevated blood pressure, so again, how does that define? That's defined as blood pressure that's higher than 140/90, and so when you go in and your doctor measures your blood pressure, a couple different things that you should understand about proper blood pressure readings. Number one, white coat syndrome is a very big factor in false blood pressure problems. So if you've never heard of white coat syndrome, this is when people go to the doctor and they're nervous and their blood pressure goes up because they're nervous. So if you're nervous going to your doctor because, sometimes that's a nerve-wracking experience for people, you should understand that that needs to be taken into account when your blood pressure is being measured and you're being analyzed as to whether or not you need to be put on a blood pressure medication. So white coat syndrome, very real problem that can lead to misleading blood pressure readings. What else can lead to misreadings? Improper procedures. And what does that mean? So there's a proper way to take blood pressure and an improper way to take blood pressure, and it's been my experience that many people taking blood pressure do it wrong. Okay, what is it? High blood pressure, I said, is defined as 140/90 or higher. And so the top number and the bottom number, what is that? This is the systolic number, this is the diastolic number. That 140, or that number on the top, is your heart, is the pressure on your blood vessels when your heart is beating, when your heart is actively contracted. The bottom number is the pressure on your blood vessels when your heart is active or is at rest. And that's the disparity, or that's the difference. That's why this number's lower, because the heart's not beating at this point. So 140/90 is considered high, and anything higher than that, obviously high. So this can be artificially elevated when the improper procedures are taken to do blood pressure. Number one of the areas I see is that the patient is not, when the patient's brought back to get their blood pressure reading done, they're not allowed to sit down and rest before that blood pressure is being taken. Meaning they just come right in, sit down, boom, the nurse or the assistant takes the blood pressure without any time in that chair resting. Remember, you can walk down a hall and your blood pressure can be 10 points higher than if you were sitting for a couple minutes before having the blood pressure read. So part one of improper procedure for taking blood pressure is not rested. If you're not rested for a few minutes, that can give you an artificial reading. One of the other mistakes I see made is that oftentimes the blood pressure is being measured when the arm is not elevated to the level of the heart. Remember, proper blood pressure reading, these numbers, okay, are based on the arm being at least this high, the same level as the heart, not down here. So what happens, a lot of people go sit in a chair and they rest their arm down by their side and somebody wraps that cuff around their arm and takes their blood pressure where the arm is too low. When the arm is too low, that can give a false elevation in blood pressure. So, arm too low is another common mistake that's made in this regard. Now, another one that I see is not so much in the procedure of it, but it's in, you get one reading that's high and instantly you walk away with the medication without having the primary conversation about diet. Now, if we look at the standard diet recommendations coming out of the American Heart Association and out of many cardiology offices, is eat a lot of grain, which breaks down into sugar very quickly, okay? And it's virtually no meat or little meat and low fat. Like, this is the predominant recommendation that comes out of the American Heart Association's heart healthy diet. Now, it's not based on any science, but that's the recommendation you get. So a lot of grain, because you need grains. Whole grains are healthy for you. This is kind of the myth. Eat a little meat because meat is bad for you and causes heart disease. That's also a myth. And eat low fat because fat is somehow bad for you and it causes heart disease, which is also a myth. This, in essence, this type of diet is a high-carb diet. And high-carb diets, we've been following these now in the research for over 30 years, and what we find is that high-carb diets actually contribute to heart disease. High-carb diets actually contribute to a lot of the problem. So even if your doctor didn't just whip out a drug right away and they made a diet recommendation, if that diet recommendation was this recommendation, it's probably not going to work. It's not going to do you any favors. In most cases, it doesn't. And so diet change is doomed to fail. It's doomed to fail, which leads us to step 2, drug intervention. Now, when drug intervention comes in, if we're talking about blood pressure problems, there are a lot of different options for drug intervention with blood pressure problems. You have different types of diuretics. You have potassium sparing and you have regular diuretics. So if you've heard of things like furosemide or thiazide diuretics, like these are just examples of water pills, basically pills that force water out of your body, make you pee more so that it lowers your pressure. It doesn't solve why your pressure's high, which is part of the problem, right? I mean, if this is truly the risk factor for heart disease, and high blood pressure is a risk factor for heart disease, not so much like cholesterol. Cholesterol is not really a risk factor. This is more of a made-up risk factor, and I'll come back to this in a minute. But high blood pressure is definitely a risk factor, and if your blood pressure is too high for too long, yeah, it's going to increase your risk for developing an issue. I would say where we have the debate is how we go about thinking about why blood pressure is high. What are the big reasons why blood pressure might be high? I've never seen a case where blood pressure was high because somebody was deficient in blood pressure medication. So very, very important to understand is that a deficit of drugs does not cause your body to break down. But what doctors want to do is intervene by biochemically manipulating your pressure without asking the fundamental question, why is your pressure high in the first place? Now, if we look at all the research that's ever been done, valid research on what actually works for lowering blood pressure, the biggest things that work are diet change, So diet change is important, but the diet that's being recommended is the opposite of the type of diet that we might want. Now, that just because this is a high carb diet doesn't mean you necessarily need to go on a ketogenic diet. But there are a lot of carbs in grain. There are a lot of inflammatory agents in grain. Little meat is not necessarily the answer, because sometimes people have high blood pressure because they don't eat enough protein. And low-fat diets are not necessarily an answer, because low-fat diets are not necessarily going to have an impact on your blood pressure. So what in the diet actually does have an impact on the blood pressure that we absolutely know, beyond the shadow of a doubt, has an impact on your blood pressure? There have been a number of decades of research studies around what's called DASH. DASH is a type of diet, and it stands for Dietary Approaches to Stop Hypertension. Medical researchers love acronyms, and this is just one of those acronyms, Dietary Approaches to Stop Hypertension. This is an ongoing study. It's been going on for several decades, and they really found only a couple of different things out of the DASH diet. Okay, from a diet perspective, it's low sodium. And it's not that salt is bad for you, and I don't want to start that myth either. Salt is not bad for you. Really, what this is not really low sodium. What they find is low MSG, and they're not the same thing. MSG is monosodium glutamate, which is a preservative that's added to processed foods. So low MSG and diets high with magnesium, calcium, and potassium. So those are the three electrolytes that help do most of the regulation of monitoring your blood pressure. In essence, low levels of magnesium can elevate your blood pressure. Low levels of calcium can elevate your blood pressure. Low levels of potassium can elevate your blood pressure. And that's what the DASH diet studies have found, is that people who follow a diet that is rich in magnesium, calcium, and potassium have lower blood pressure, and that people who eat less processed food in the form of MSG have low blood pressure. That's what we know from a diet perspective. Well, if we look at this, right, this standard American Heart Association diet, all that grain is, all those processed grains that people are being recommended to eat, even the ones that say whole grains, they're only partially whole grains. What are they low in? They're low in these things, and they're very high in filler, so it's a bad idea. And so it doesn't serve you to achieve this goal. Now, how can we achieve high levels of magnesium, potassium, and calcium? Some of the best ways are eating lean, healthy, quality meats. You get a lot of calcium from that, things like bone broth, but also lots of vegetables. So vegetables with lots of vegetable fiber. Vegetables can be rich in these minerals as well. So those are the things from a diet perspective, and this should be common sense. Unfortunately, it's not, that doctors should be teaching but don't teach. And so what happens is, when this American Heart Association diet fails and people don't even know to go and look at these things and to do these things, instead they're gravitating to things like Honey Nut Cheerios to lower their cholesterol. So they're gravitating toward a sugary cereal with a dairy product or a milk product that is high in carbohydrate, right? And it's full of hormones, and it's from cows that are genetically modified and fed genetically modified foods, and their milk has got pesticide residues and other things. How can you get healthy eating those things? And the answer is you can't. But that's what people do, because that's what commercials tell people to do. And realize that the vast majority, and this is from my opinion, the vast majority of what I see mainstream doctors being educated in nutrition, actually a vast majority of their education comes from TV commercials, because they espouse a lot of the rhetoric that you see in TV commercials, like osteoporosis is caused by calcium deficiency, you just need to take more calcium, or we need you to eat more oat cereal or oat bran because your cholesterol is too high. Like, that's the rhetoric from TV commercials for different companies trying to sell you junk food in the guise of health food, to tell you it's going to be healthier for you. And a lot of times that same advice comes from the mouths of doctors. Any of you follow me on Instagram saw the post I put up the other day on the product that was being basically peddled by pediatricians to small children who weren't growing. It was a Pediasure product. It was, the first ingredient on it was genetically modified corn syrup. And so they were saying, drink 2 of these a day to help your children grow. In essence, this is what they know about nutrition. They push things like corn syrup on your kids to make them grow, because they don't know anything about nutrition. Now, I'm speaking in broad generalizations here. I'm not saying that all doctors are ignorant on this topic. I'm just saying that the vast majority of them are, because they don't seek out additional training. And the one that you've been to may be one of those that is ignorant and thinks that this American Heart Association diet is going to help lower your blood pressure when in fact it won't. It'll actually raise it. So again, I want to dispel that diet myth. And those of you who haven't read No Grain, No Pain, grab your copy, because the diet and the changes that you make with that diet can completely, and I've seen this happen numerous times, normalize a person's blood pressure, normalize a person's triglyceride levels. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.